Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. A huge thank you to Health Asia, massive team, and of course Dr. Zaki Udin. It's a huge honour to be here today to represent the UK, and a huge opportunity for cross-border collaboration, which I think you'll find is really important when we are looking into lifestyle medicine. Okay, so I really hope you enjoy my session today. It begins with epigenetics and nutrigenetics, the earliest blueprint for longevity. I want you to maybe think a little bit about if our DNA is the script, how much of that do you think we can change through nutrition and lifestyle? So as I go through the presentation, please really think about this. Is the genetic sequence our destiny, or can we change this? Okay, let's go ahead. Before I move on to the next slide, in fact, does anybody know what epigenetics is exactly? Okay, great, a couple of people there. Fantastic, thank you so much. That's a really good, succinct definition there. Fantastic. There's no Greek counterparts in this room, I don't think. Okay, so it's great. Thank you so much for that. So just something to think about. So we'll have a look at the definitions of epigenetic and nutrigenetic and the mechanisms that shape the health and longevity side of things when it comes to our healthcare. And really recognizing the critical early stages in our life. Okay, so we don't have to wait for when we're 50, 60, 70 to make changes. It's never too late, and it is, in fact, reversible. And I really want to highlight also global research that is happening, because I think it's really important that we learn from each other. Cross-collaboration is really important, and we cannot work in silos. And looking at some MDT approaches within lifestyle medicine and longevity, and how we can collaborate moving forward to advance this field. So, epi means upon, over, or in addition to, on top of. Okay, so this is on top of our gene DNA sequence. It does not change your DNA, but like this gentleman said, thank you very much, we can turn them on or off depending on our nutrition, our lifestyle, our environment, and I would like to kind of deep dive into that today. But there are three mechanisms to bear in mind. We have DNA methylation, histone modification, and non-coding RNAs. They're really important. They're the ones that change our gene markers and variants, and we'll have a little look at that as well. So, as I said, they are modifiable by environment, nutrition, stress, toxins, and sleep. Okay, so there was a study here, a recent study in 2024, I believe. There's transgenerational changes. Okay, so we can change them individually. However, what has happened in our forefathers has an impact today. So let that sink in, okay? However, this is not a blame game, right? Whatever happened then, people were exposed to different toxins, lack of sleep, people's occupations have an impact on lifestyle medicine and their own longevity and their genes. So this is something we can still change. And this is a really good study, and it's actually quite an upcoming foundational study as well. So, we can see pictures of bees, right? So you're probably thinking, what is the point? Why is she showing me some bees? We are human beings. But this is a really foundational study looking at bees, because it really hones in on epigenetic changes. So imagine you're a bee, okay? You can be the queen or the worker bee, it's okay. We're in the beehive. The workers do not have what we call the royal jelly. The queen does. By having this royal jelly, this special jelly, this changes her genetic markers. They share the same DNA, the queen and the worker bees, absolutely the same. What changes it is what she has, which is the royal jelly. This increases her fertility, and then she remains the queen bee. Okay, so this is a really good foundational study, and something just to kind of set the scene. But how does this apply to humans? Let's have a look. There's something called epigenetic drift. Why does this matter? Okay, as we age, the drift changes, but we can reverse these changes to make them preventable, avoid things like cardiovascular disease, neurodegeneration, so Alzheimer's. This is really, really important. And we can start looking at more of the prevention lens, the precision medicine lens, okay? I think the one-size-fits-all approach, we no longer want to do this. We want to move away from this. This is so, so important. If we want to prevent disease, make sure we age gracefully, hopefully, inshallah, but live a longer life with vitality. Put your hands up. Who wants to live a longer life, but without vitality? Without vitality. Okay. Who wants to live a longer life, potentially, but with vitality? Please put your hand up. Of course. Who doesn't want that, right? So you don't want the aches and pains in the knees and the hips and the back. You don't want to have type 2 diabetes, cardiovascular disease, cancer risk. Despite them being in your family, we can change this. So I think epigenetics, in my opinion, gives us hope as humans, clinicians, and innovators. So at the bottom here, I'm not going to go through them because there's so much more to discuss, but there are some evidence in terms of epigenetics, some really good, modern, up-to-date evidence. Just one thing I want to highlight. Identical twins, okay? So they share the same DNA. However, this study demonstrates that actually the epigenetics can be changed regardless of changing the DNA. So that's a really interesting study if you want to have a little look at that. And just at the bottom here is just an example from 2010, still a foundational study, but most recent one Yang et al. 2025, just to show that folate, polyphenols and lifestyle, if we include more of those, we can change our epigenetics and really what we call modulate that drift. We can change that epigenetic drift so we live with a life full of vitality without the aches and pains, without the disease. So the disease prevention is key. So just some factors, okay? So we have the father's diet and lifestyle, maternal nutrition. We have the mother's pre-pregnancy diet, of course the baby's nutrition when the baby arrives, and the first age, and of course the continuation of life. A lot of people wrongly assume, it's just the maternal diet, the maternal changes that influences the baby's epigenetics and health outcomes. This is not true. Okay, we do need to include the paternal side of things, and together we can make a huge difference to better health outcomes. So the sooner we understand that, the better we can help our patients, our families, and globally as well. So being a clinical dietitian, people think that I just focus on nutrition. Absolutely not. Okay, it's really important that we integrate exercise, movement. I like to call it movement because people are scared of the word exercise. Okay, so movement, even if it's just working on your steps and then building. This is what I do with my patients. You have to meet them where they are. Stress management is really, really key. If we are trying to manage stress, that means our cortisol hormones are reducing, which means we're less likely to preserve things like the fat, okay? And essentially we want to burn that, okay? Especially visceral fat, the one inside wrapping around our organs, that increases things like cardiovascular disease and other type 2 diabetes and other metabolic health conditions. However, I also look at environment. This is really, really important. So in my assessments, when I see patients, we look at what is their occupation? What is their home life? Are they married? Are they single? Do they have children? All contributes things like stress and the dynamics in the family. So we can see psychosocial and environmental factors impacts on gene expression. For example, childhood trauma. This has a massive impact on whether our genes turn on and off and whether we're more predisposed to other health conditions later in life. So, for example, the stress response, the immune function, the neurodevelopment of a child is hugely impacted if they're not in a safe environment. So, how do we tackle this? Okay, every home is not perfect. However, we do know the evidence points to a safe environment, bringing up children around, family, extended family. This is really, really important for neurodevelopment. And of course, it's important that we think a bit about the treatment has to be trauma-informed. Okay? Again, going back to the nutrition and lifestyle, that will help with reversing a lot of the trauma. It's not a perfect, it's not a silver bullet. However, there is something we can do. There is hope. So just a bit of an example at the bottom here. Omega-3s, folate and exercise, again, like there's evidence to suggest these kind of changes has an impact on a child's development as they grow up. So trauma-informed as well as nutrition and lifestyle changes. So you can already see the lifestyle medicine and the functional medicine side of things when it comes to epigenetics. So this was a really good foundational study in 2008, intergenerational effects. So what they wanted to investigate whether prenatal famine exposure leads to persistent epigenetic changes. And they found it actually does, compared to the siblings that were born after the famine that happened. So as you can see here, and of course, do your own reading, it's a really interesting study. Early gestation exposure, 5.2% lower IGF2 methylation occurred, which persisted over 60 years and is specific to early gestation. So after that, the siblings, the results were a lot different. So the ones that were exposed to the famine were exposed, the outcomes were really bad when it comes to health outcomes, but actually further down the line, it shows that there are some epigenetic changes influencing disease risk. So I'm now going to move on to nutrigenetics, where it kind of gets personal because I think it's really important that we differentiate between what's nutrigenetics and nutrigenomics. A lot of people, it can be used interchangeably, but people get confused. What is genomics? What is nutrigenetics? Nutrigenomics? Okay. So as you can see here, nutrigenetics is how your genes influence how your body reacts to food, how we individually metabolize food. And then, of course, you've got the opposite. What you eat influences your genes as well. This also explains why, if anybody has treated patients, that a one-size-fits-all approach does not work. Okay, so this is really important. So historically, we've kind of said, right, here's a diet, off you go. You hope for the best. Okay, everybody in here is genetically different, ethnically different. Okay, I was just in Abu Dhabi just a few days ago. Of course, there's so much, different variation in genetics there as well. We cannot use the same thing for the same person. This is why we need to go down to the cellular level. Okay. But why does it matter? I kind of covered this a little bit already. Okay, so your nutrient absorption matters individually, your metabolism, the disease risk, the prevention. Where do you fit when it comes to prevention and what you can do about it for the future. Optimizing performance as well. So there's a lot of clinicians, a lot of sports people really looking into this and this approach. And so this is important, but why not us? We don't have to be an athlete to make these changes. So let's do it now for our, globally and our communities as well. So I'm just going to go and skip on to the examples of genetic variants. This is really important. So we have the OPOE. I can't cover all the genetic variants, but these are really good examples. So this OPOE variant is responsible for lipid transport, cholesterol metabolism, and especially the E4 carriers. They are higher risk of things like dyslipidemia and cognitive decline. So recommendations, how does that work? So we need to limit saturated fats, promote more omega-3 rich foods, and encourage dietary patterns with carotenoids. So lots of fruit, lots of vegetables. So this is one example of OPOE that we need to adjust for each individual patient if they're showing high risk with this E4 carrier. We've got the FTO as well. So this is another example and what we need to change. So a recommended higher protein diet, a low calorie restricted diet for A allele, this long number here, needs to be managed for people at risk of obesity. And something a bit more about reducing the obesity risk. So really getting the exercise and that nutrition in, but making sure there's less of the carbohydrates, less of the processed fats, and more of the higher protein. This is another genetic variant which reduced enzyme activity if you have the TT genotype. So especially, of course, in pregnancy, but obviously you don't have to be pregnant for this. This is really important for ourselves as well. This is an example of someone to reduce the risk of CVD. So you can see the kind of changes we need to make. These are just examples of the different variants here. I'm just going to quickly skip now to the global research because I think that's really, really important. This is what's happening now around the world. So we have the UK Biobank. Of course, I'm from the UK. So Genomics England is apparently, I quote, 10 years ahead globally when it comes to genomics, which is really, really fantastic news. But there's a lot of cross-collaboration as well, as you can see here. And then we have the Emirati Genome Programme, which they're already investing a lot of money. And what is involved in there is the infancy screening, which is really important, right? So we're not leaving babies to develop and then later on using a reactive approach. We're doing a proactive precision medicine and preventative approach. And then you have the premarital screening, in fact. Okay, so looking at the genetics there and making sure, when the couples are getting married, they know what's going to happen in the future. Again, prevention, proactive, and we all need to advance using this type of lens. These are the 4 Ps, precision medicine. Okay, so I'm just going to whiz through this. So predictive, preventative, personalized, participatory. This is also important. I've already talked about these ones. This is also important. There's no point treating patients if they're not interested. We need to get them interested. We need to educate our patients and ourselves, okay? But also collaboration with other healthcare providers as well. And, AI, digital innovation, making sure we have the digital twins implemented in this type of the steps towards advancing when it comes to the 4 Ps and lifestyle medicine and longevity, and of course functional medicine as well. These are just some examples of what the landscape is looking like, okay? Different professionals have different roles to play. As you can see, you can read for yourself. Policymakers, this is really important. Who's involved? Promoting equity is so, so important. We miss this a lot, right? Why do this if if people are not going to be able to have that equity in their healthcare? Okay? Are we serving the underserved populations? Or is it just for the VIPs? Is it for the insurers? Yeah. So it's really important we establish healthcare equity. So mind the gap. We need to identify these gaps. We need to address them, allow people to have access. And this is why I have it here, because, we need to have a little look at that. So it's just some key takeaways. I just want to leave this message. The greatest gift we can give future generations is the earliest blueprint for longevity, shaped by our genes, refined by our choices. Thank you.